All right, good evening. This is Amelia here with the SoMe Docs physician panel following our Tuesday night lecture series. And last night we heard about reviews. And so we had the TripAdvisor queen join us and talk about the power of reviews, how to ask for reviews, why people might be hesitant to give reviews. And we're going to extend that into medical practice and also some of the other side gigs that we have associated with medicine and the place that reviews play in our lives. I have some amazing panelists here. You probably saw a lot of their comments last night, and we're going to get into this discussion. So I'm going to go around and have each of you introduce yourselves and tell us how reviews are coming up for you currently. Sheryl, let's start with you.
Hi, my name is Sheryl Recinos. I'm a family medicine physician that works as a hospitalist in Los Angeles. I work inside of the hospital, so I don't have my own practice. And so most of my review expertise comes from the books that I've published.
Mm-hmm. All right. And Jill, how about for you?
So I'm also a family physician. I was in private practice in Austin, Texas for about 20 years. And so during those 20 years, I actually didn't worry so much, to be perfectly honest, but we had the issue of reviews. And, but currently I am mostly dealing with reviews also as a book author. And so we'll toss that in there as well.
Excellent. And Parastoo, tell us about you. Where are you and how are reviews coming up for you?
So I'm a gastroenterologist and currently I practice in Austin, Texas, and I'm 100% clinical. So basically the review comes from the clinical work and the clinical flow, mainly through HealthGrade, Google review, and Yelp. So yeah, that's how we get the reviews coming.
Excellent. And let's look at yesterday's conversation. Were there any key points that came up for you that either really inspired you or maybe challenged you as you were thinking about how you get reviews, how you deal with reviews, what reviews can mean? Sheryl, what did you notice?
I really like Jill's comment where she mentioned that it's not possible for, I believe it was Jill's comment, or maybe it was someone else's comment, but it was where we were mentioning that it's not really possible to speak against reviews that we've received in the medical field because it would be a HIPAA violation. Because at that point we are, owning up to the fact that that is actually our patient. And so it's such a different world when we're talking about what we can do within medicine versus all of the other fields.
Mm-hmm. And how about for you, Parastoo? Did you notice anything watching it that spoke to you, either as a challenge or an inspiration?
Yeah, for sure. I think so the main contrast for me was the comparison between hotel industry, which is 100% customer based, and medicine, which I'm sort of like on the side that medicine, cannot be really sort of like 100% customer based because of the nature of it. And I thought a lot of comparisons, they don't go hand in hand completely. Specifically, when we go to hotels, obviously it's mostly a planned vacation. The expectation, I think, that's set is just we are going to have fun. It's all fun, even if we have a flight delay or if things go wrong, but still the prospect is that the next few days that we are staying there, you're going to have a blast. So it's really different, the way that I think we see that as an experience compared to when we go to see a doctor or when patients come to see us. And they have usually, a laundry list of things that are not, sort of like going well, and they're tired and they're really fed up. And, as it was brought up correctly, most of the time patients have to wait and then come and see us. So I think the comparison was not really sort of like a basically hand-in-hand comparison. So it was more like an apple and orange to me.
Yeah, and Jill, like we saw not many comments from you yesterday. What are some key points that you noticed that were either challenging or inspiring from yesterday's conversation?
Well, quite honestly, as I was watching last night, I was reacting and frustrated, and I just wanted to scream that it is not the same. They are absolutely apples and oranges, and in primary care, especially. People definitely do come in with a laundry list, and they're in a 15-minute slot with a laundry list and what they think is important. And they mention, oh, by the way, they had this chest pain that we're like, wait, we got to talk about that. Or maybe they're very seriously depressed. And what I wished we could have sort of shifted the discussion to what would have been, how can we, patients being frustrated with waiting is absolutely legitimate. And it is definitely a big thing that they complain about. But how can we better educate our patients about why there are waits, and rather than just saying, okay, we're not going to make anybody wait, which would be great. I would love an office that ran where that happened. I'm not, that's my least strength, let's just say, because I always want to listen to what patients have to say. And, so I wish we could have shifted that a little bit, but I will also say that rather than just being annoyed and sort of blowing off everything she said, which was where I was a little bit headed last night, I think it's more important for us to figure out what really can we take home? What points should we be really thinking about? And, reviews are a thing. They're a thing for private practice. I'm realizing I'm in Austin, Texas. I'm a primary care physician, and I may see one of your partners for all I know. I'm not sure which group you're in, but we can ask our fellow physicians who are our patients, hey, would you please write a review? Because I would never say no, but I'll be honest, I wouldn't necessarily think to do that all the time. I have done it for many physicians, but I think that's something we need to get more comfortable asking, because I think, peer to peer, we get it. So that was my take home.
Yeah, I think that's a great point as well. Where can we garner the reviews safely, right? And maybe adding the deck, but also just saying, we want to see what is actually important here, right? And what is valuable, and how do we demonstrate that with the reviews? And I think it's so powerful to notice, right? So we all probably had a similar first reaction, right? Well, this doesn't apply. Why do we even have reviews? Like, we go through this whole defensiveness, and like you said, but it's a thing, right? And so if we're fighting reality, we know we lose every time. So let's just see what there is in here that we could gain from. And Dr. John Lynn, who was on last week when we talked about audio, left a lot of comments yesterday, and he, utilizes reviews a lot in his practice and finds ways to reply to them without violating HIPAA. And Jill, you already highlighted a key factor, like asking our peers with whom we interact as, physicians and patients to leave us a review. What are some other ways we could gain from this and notice, okay, if reviews are a thing, how can we engage with them in a functional way? Sheryl, does anything come up for you when you think about it that way?
Definitely when Jill was speaking, I was thinking about some of the ways that I've been successful with getting reviews for my books. And it made me think about how that really could translate towards the medical community. Because, one of the things that some of my reviewers have told me who have read my book and know me is that they want to know how they can help me, but they don't know unless I ask. And so putting that ask out there has been very important for people understanding ways that they can help me, so that I can continue to provide, valuable information. And in the case of medicine, to provide valuable medical care. And so it's very important that we find a way to ask. And, I think people will come through if we provided them with valuable care.
Parastoo, how about for you? Anything that we could gain from there and how we could functionally move forward with reviews?
So I actually have been thinking about that for a while, because so I myself have some issues asking patients to leave me a review. And usually, what happens if you don't really take control of the reviews, I think then you end up with these sort of more like passive aggressive reviews, and people review you that they didn't have a great experience. But I agree, if we just basically incorporate that into our practice and actively seek everybody's reviews, specifically patients who had great sort of experience coming to the office, I think the chances are higher that we can get more constructive reviews. We can also just increase the number of our reviews, and sort of that way, if there's here and there's just some random bad reviews, they're not going to affect our practice that much. So I was thinking, I think maybe, as everybody agrees, I think reviews are here to stay and they're getting more power, with time. So it's not something that, this is not a battle that we can probably win, but we need to basically realize how to live with them. Mm-hmm. And I think as I was thinking, I think as we have probably office manager, clinic manager, we should go that direction, that we should have somebody, I think, that can help us with that, can even, up front, just basically just talk to the patient or ask them, okay, we would appreciate, a 5-star review if you had a great experience. Not coming from the doctor. Maybe, a lot of us, we are sort of like more value-based and we don't sort of like feel comfortable to ask our patients. But I think if we, designate somebody as a role that they just deal with this type of conversations with patients and ask everybody, or just, basically after the visit, somebody goes to the patient, just like a survey, just a short 5-minute survey. So give them sort of like a survey and see what they think, what their experience was.
Mm-hmm. I think that idea of facilitator is great. Go ahead, Jill.
So I have a real issue with the phrase, I would never want to ask for or have my office manager ask for a 5-star review. And I know that I just bought a car. And you know how every step of the way, like they ask you 25,001 times, is there anything we could do differently before you get the review? By the way, you're going to get a survey and we really need it to be 5 stars. And I mean, that just, after how much we've been evaluated in medicine, it just rubs me the wrong way. So, and I'm not picking on what you said, Parastoo, I as much as my preference would be that, and I come from having had a small private practice, not in a big, huge group practice, but in a small group practice, if somebody walks out, especially if they're a new patient, and as they're checking out, they're making their follow-up appointment, they're like, oh my God, I just loved her. She was the best. She really listened to me. If someone is spontaneously raving about the physician, by all means, let's have that receptionist say, if you liked her that much, we would love it if you would take a minute to go to whether it's Yelp or wherever it is that your practice is getting most of the reviews. We'd love it if you took a minute and put something up there.
Mm-hmm. Yeah, that's a nice way to capture that enthusiasm, right? And they may be willing to do that, especially if they've not had those positive experiences. So when that happens, being supportive in that way, I think can be so helpful. We talked a little bit about managing expectations, right? So that patient often leads to the negative review. Have you found successful ways to help with that, to help manage expectations? Because we know that can often be the source of disappointment, is when we have an idea and it doesn't come to fruition. Sheryl, has anything come up like that for you?
Not within my medical practice, but I really like what Parastoo was saying about, asking at the end of the visit, because if there was an issue, that's the perfect time to address it. Because if she has somebody trained within her office that is talking to the patient and, they didn't have that 5-star experience, whatever we call it, that is the perfect time to say, well, what is it that you needed that you didn't get today? And perhaps, that would give us what we're looking for as physicians, because our goal is that value care. And, we still need these reviews. And so I think it is a perfect way to kind of balance out that system, since reviews are here to stay.
Mm-hmm. Yeah. And for that management, you mentioned, that follow-up, Parastoo, what do you think about ahead of time? Does your office have any management procedures, how they check in with people on the way, anything of that nature?
So we don't currently have anything of that nature in place. But that's something that I was thinking it's going to basically, it's going to help a lot in terms of just like basically we get the feedback from the patient. We know what their experience was. And if there's anything that we can obviously change to accommodate the needs of the patient, which I'm sure there are plenty. And I think when we have a lot of feedback, that's when we can just like start thinking more profoundly what steps we need to take.
Yeah, I hear that old school suggestion box coming up, right? Like, what could we do to make this a better experience? And actually, sometimes it can seem silly when we're very focused on the clinical work, but there are little things that happen along the way, people with whom they interact that do make a big difference. And so being open to that, I think, can be really helpful. Jill, how about for you in managing, private practice? How are you able to manage that experience?
The biggest complaint, honestly, that we ever got was the wait. And so there was a time in my practice when it was I did my own practice for about 10 years. And then I worked as an employed physician in another small practice for another 10 years. And in mine, for a while, we actually just put up a little something I wrote that was in all the exam rooms that was sort of that explained why physicians run behind. Mm-hmm. And I got a fair amount of good feedback about that. They're like, I never thought about it that way. And people know when you're present. And I have some. Well, I'm going to leave that there. I was going to say I have some gender bias, but I'm just going to leave that. But people know when you're present, and when it's so. The electronic medical record certainly makes it challenging to be typing and then looking to the side, and it's harder to have that just hands in your lap, good body language, really listening to someone when you're also taking notes. But we do our best, and people know when you're listening. And I think giving the verbal feedback cues that we're all taught to do, So what I hear you saying is blah, blah, blah. Even if you're just typing, I just want to make sure that I have this correct. So you said that your stomach pain started when you were age 10 and you're 30 now. But just the more connections like that you can make, the better. And the other, just in general, the more connections, the better. And so I'm terrible with names. I can tell you someone's entire life story and their extended family's life story, but I may not be able to come up with their name. So, but I always would take extra notes to myself that, about their kid or their dog or something that we connected on. And as a quick reminder to me when I'm looking at the chart before I start talking with them. And the more you can make those personal connections and in a sincere way, I mean, I need memory triggers, but that doesn't mean I'm not sincere about connecting with them about whatever thing that we shared. But the more that you have that, the people like you, and they appreciate the care, and they feel like they're well cared for. So I think, it's easier to do when it's not a 15-minute slot, but the more we can connect, the better.
Mm-hmm. Yeah, there's a lot of dialogue going on in the chat. We're seeing a conversation around the running on time concept, which could in itself.
Oh, I can't see any of that.
Yeah, I'll share with you some. We're talking about, why do we not run on time? It's disrespectful for the patients, that it's not intentional. And of course, knowing we're doing everything we can to run on time, looking at the systems that double book us, right? We can kind of do a whole big analogy there. And noticing the way that we do address it when it happens. Right. And there's been lots of proposed recommendations where it's, thank you for your patience, or thank you for waiting, and I respect your time, and even just owning it up front, right? Powerful in that way, and certainly trying to prioritize, our timeliness in each visit, of course. And we have a comment that social history is extremely important. And that came up during your discussion of connection, Jill. And for each of you, how does that come up, and how do you tap into that? And how do you see that perhaps relating to someone's experience, and how that would influence a review ultimately? Sheryl?
For me, my social history I'm obtaining for patients that are being admitted into the hospital setting. And so they're quite sick, but their social history is so relevant, because that's usually where I can find, why things didn't work and why they got sick enough to come to the hospital, and how I can eventually get them home. And so I don't have that same clinic setting. But with my patients, a lot of them come back to me multiple times, and I get to know them very well over multiple admissions. And so there is a sense of connectedness, even though these patients aren't, rating me. I get to know them quite well over time.
And I think identifying that social history can be that place of the barriers to health, right? So we might get the patient's story and they may not notice, but in social history, the questions come out differently. And so they can be some big reveals in there. Parastoo, how about for you? How does social history come up for you with your patients?
I think that's a very interesting question. I think for us as a specialist, so we don't really focus much on social history. I think primary care is more focused on, knowing their patient's continuity and then know their social history. For us, there are certain things, for example, if I'm seeing patients with liver disease, I always get just sort of like an extensive history of, using drugs or any other medication or anything that they have been doing. But to be honest, just having a 15-minute slot, just, going through everything, I really don't focus much on social history. So they are just like basically with electronic medical records, the things that are pulled over from the chart. So I quickly take a look at them and that's it for me. So I spend most of my time getting history and discussing the assessment and plan with the patient.
And Jill, how about for you? Do you notice that coming up? Social history as an influencer?
As an influencer on the reviews?
Of their visit in general, right? You mentioned connectedness. And so how does that play into that for you?
Well, currently I'm in more of a college student setting. And so social history, the biggest things I'm going for in social history, social history is just hugely important in primary care, but for me, I want to know if they're smoking, what they're smoking, if they're smoking, going through all of that, being able to, figure out if that's something that we need to address, drinking history, alcohol, as well as their living situation. In college, there's a lot of issue with roommates and then, just extend, the outer circle of the social history. Are they having any food insecurity? Are they stressed about paying for college? Are they the first one in their family to go to college? So yes, all of that is always critical.
And we can hear in there a fine line, like many things in medicine, where we can feel seen and heard and acknowledged as a whole person, but then also perhaps blamed, right? So if it's comes up in that way, so there can be a lot of nuance in how we frame that and how the patient receives that. We have a comment in the chat. I'll read it and get your feedback on that. And this is from Akash. Healthcare is inherently a social network experience as opposed to an individual experience, like in getting a hotel room. If I want the doctor to pay full attention to me when I'm in the room, even when unexpected things come up, then I must be willing to have buy-in that the doctor may do the same for other patients. But the doctor must convince his or her patients in their practice of this. How does that speak to you and what reflection might you have?
For me, that just buys in with what I put literally on the exam walls that sort of explained what types of emergencies come up and what types of discrepancies on how much time someone was allotted versus what turns out that they may really need. And that, rest assured, I will give you my undivided attention. And I can promise you every time I've walked into a room that I have walked in late, and I obviously I try to run on time. And it's actually been much easier in the college setting, partly because these kids have less past histories and less other things that extend the visits. But if I walk in late, the first thing I do is I absolutely own that. I am so sorry. I appreciate your time. I'm sorry that you ended up waiting. And, possibly we had an office emergency or just leave it at that. Sorry. And then I just jump in.
Yeah. Parastoo, any reflections on that comment or concept?
I think communication is the key here. And as Jill was bringing up, I think the main thing, even if you're running late, just like bringing that up, apologizing, explaining to the patient where you're coming from. I think a lot of our miscommunication comes from the fact that basically we do not communicate properly. We do not talk about the things that are going on. I've really learned that throughout my practice that, it's always whenever I'm feeling like, I'm stressed out or I'm in trouble for any reason, running behind, just basically having distraction, have to attend to multiple different things. I think just being honest with patient and just, putting this out really helps and can go a long way.
So we're having your nurse run in there and say, I'm so sorry. It's going to be another
Yeah.
20 minutes. The worst
Totally.
thing, we've all been patients too. And the worst thing is going somewhere and then just sitting there, and you're sitting there and no one says what's going on. So I think communication by whatever staff member just helps you have better expectations.
Yeah, that's echoed in the comments as well. Sheryl, how about for you? Any other thoughts on that?
Well, I feel like what was mentioned about buy-in is very important, because if the patient feels that level of trust where they can trust us with their, most private thoughts or most private activities, then they can tell us what we need to know so that we can help them get better and become healthier. But if they feel like they can't trust us, then they're going to keep that to themselves, and that's within their rights. But it doesn't help any of us help them get better. And so it's really important to have that great communication and really find a way, even with all these computers and EMR, to still look them in the eye and be able to communicate with them, even if, they give us that doorknob question as they're getting ready to go out the door.
Mm-hmm. And one of the acronyms that was used yesterday was CARE, cared for, appreciated, respected at every encounter. And I hear a lot of that in what we're saying here. So there's a takeaway that can match right across all industries. And we can have our own thoughts about medicine as an industry, right, versus a service, oriented space. But we do need, right, revenue and sustainability measures, and that can be tricky to balance. What comes up for you when you think about that CARE acronym? Cared for, appreciated, respected at every encounter. And then maybe as a patient perspective, we shared that a little bit earlier. How have you engaged with that as a patient? And when you haven't, what have you done? Have you communicated that? Have you left a review? I would guess probably not, but it'd be interesting to see. Jill, how about for you? What do you think about CARE?
Well, in the university setting, let me just tell you, we spend our entire in-service on this.
Mm-hmm.
You start with signage. You start with, bathrooms. You want to make sure everyone feels welcome. And we have T-shirts that have rainbow letters, so spelling out healthy horns, and which is the university. And starting at from the very beginning, whether it's when they're checking in and making sure that everyone has the titles that they would like and what they would like to be called, and then calling them what they would like to be called. All of those things have to do with setting the environment of care and then following through on that. So yes, that's all critical.
Mm-hmm. Parastoo, how about for you? The cared for, appreciated, respected at every encounter, either giving care or receiving it.
So I think that's a very important concept. So as human beings, we all basically need to feel that respect. It doesn't matter what side of the table we are. So I've been patient. I've seen my colleagues, and interestingly, I've been sort of like not getting, sometimes occasionally, I would say I've been getting the care, I've not been getting the care that I expected. And it's very frustrating. So I know that side of it too. But, I think having sort of like the experience of both sides at least gave me this sort of like, so I had these tools to, sort of like analyze things, sort of like, and figure out sort of like why did this thing happen, or try to understand better. But I agree that by any means, you cannot really, you cannot justify lack of care and lack of respect, no matter what side you are.
Mm-hmm. Yeah. And Sheryl, how about for you?
I've had both kinds of experiences, the ones where I didn't feel respected by physicians and the ones where I have, more so when my children were being seen by doctors. And so for me, I'm in that odd place because I go incognito as a patient and I don't tell them I'm a physician. And so sometimes I don't get the care that, we're trained to expect. And, it's very challenging to see that that's the way that patients are treated. And I do speak up to it, especially to like a nurse manager, or I speak with the physician directly, because usually the issues that I see are more of, what's going on in the waiting room. Is the receptionist, not helpful as I would have liked? And so it gives me a point where perhaps I can choose to give feedback, or perhaps I can choose to go to a different doctor. And so those are important things for me, but it's unfortunate because do I really need to tell them that I'm a physician to get excellent care? And I've experienced poor care. And like I said, with my own children, I've experienced excellent care. And sometimes I wish I could have a pediatrician.
So making sure we leave those reviews when we have excellent care, as we've mentioned. And that is something that's challenging, right? So much of that experience is beyond your direct control, and the reviews are beyond your direct control, right? A patient can say anything that they want on them, right? And it gets published. And so how do we handle that? Because when things are outside of our control, we lose our power, right? But we're also made responsible for them. So, we're made responsible for this outcome, this verbiage that's there. How do you manage that? How do you deal with a less than ideal review? Parastoo, let's start with you.
So it's a very interesting question. So I've had reviews that really preoccupied me for days and days and weeks, and they were anonymous. So I couldn't even just figure out who the patient was and what occasion was that and why did I get that review. Although, and it was just sort of like, I think we take it to heart, right? We take it very sort of like personal. Then I think I learned, so this is just a learning experience for me, and I should not question everything that I have as a physician when I get reviewed, because as you said, this is something that you don't really have any control over. So I try to learn from, if there is any point that, sort of like if there is any feedback, I really try to figure out what's going on. But what I realized, as I think was brought up earlier by Sheryl, is a lot of these reviews are coming from admin part of, the work. So the receptionist, the assistant, the medical assistant, the workflow, and, basically patients felt like that they were not respected when they were waiting in the waiting area, or, people did not explain things, as they should have. So I've got those reviews from the office and the office staff. But, it's very tricky. I think it was brought up yesterday. Donna brought that up. And it's a very legit point that as physicians, we are not these days 100% in control of what's happening in our offices and in our practices, unless we are in private practice and we own our practice, or we have just a few partners that we are just like working with. A lot of us, we are working for big hospitals, for big corporates, for private equities, we are employed, and we really do not have much say in the way that the office staff are employed or fired, or the workflow or the policy, and the amount of time that we have to see patients, and a lot of these things. So I think it may be seen from outside that we are in control and this is our practice, but to be honest, it's just we don't really have much power here.
Mm-hmm. Yeah, and that can be challenging, and it can only take just a moment. Even in a private practice clinic with one staff, if that staff is having a crummy day, that can be enough to tip it over the edge. And so I love how you pointed out, trying not to take it so personally, right? So it can be instructive and informative. It doesn't have to be demeaning or detrimental to your, core value as a physician, as a person. But it can be hard to differentiate that, right? When it can seem very personal. Jill, how about for you? How have you managed with less than ideal reviews, either clinically or with your books?
So the worst review I have had was on the first book that I wrote, which was, it's called Seductive Delusions, How Everyday People Catch STDs. So it's an STD book, and this is not something that has, as broad an audience as you might think, as perhaps it should. But one of the reviews was, it was just wrong. Like literally they said that they obviously didn't open the book, and they said, she doesn't list, but it was like very specific things, like, she doesn't list treatments, she doesn't list this, that, the other. And it was just so, and of course I got upset about it, which is ridiculous because it's like, it's not even true. But actually, my publisher addressed it with Amazon, and they took the review off because they said this is ridiculous. And I wish it were that easy with for practices, but it's easier said than done, but I totally agree with everyone that you need to look at it, take a step back and think, okay, is there anything I can learn from this? And if there is, great, learn from it and move on. But, my nature, like I do a lot of speaking. And so like I'll speak for the American Academy of Family Physicians and I'll have these great reviews and I'm just like, oh, yay, 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 yay. And then this one that says, yeah, I really wasn't worth my time. I didn't learn anything. And days and weeks, you're like, oh, why didn't I, what could I have done differently? But, you got to look at, if the vast majority are positive, keep doing what you're doing and, just keep moving forward. And if you have to drown it out, then I think that's when our office managers need to step in, because like the main thing that my peers have complained about getting negative reviews for in family medicine is not giving pain meds for someone who was drug seeking, frankly. As evidenced by you called 4 different pharmacies and, they said that they didn't have any prescription of Vicodin and your nurse or somebody call 4 different pharmacies and they've got, 90 from 3 different places. So I'm not trying to be so derogatory, but someone who didn't get what they came in wanting, they wanted an antibiotic and they had a cold. And, if those are up there and it's, I think that's when you need to be asking people that are saying, oh, I had a great experience, that at that point, if someone volunteers that, you need to take advantage of that and say, would you mind leaving a review?
Mm-hmm. And that sounds like that could be an opportunity. We've talked about how to address reviews still within the constraints of patient privacy. And if there was one specific to that, lack of prescription of a certain medication, responding perhaps with a neutral statement regarding, practices and, not
most sinus infections don't require antibiotics.
Right. So we have some response to it to acknowledge, right, this is within the best practice or this is an office policy or et cetera, that doesn't necessarily attack, and so how could you craft a response to a negative review that might be in both a neutral, right, non-identifying mode, non-defensive, right, and not even necessarily explanatory in a justification, but informative and educational, both for that review and also for future expectations in the office. Any thoughts around that, Sheryl?
I think it's challenging because I think if anyone can identify who that patient was, then you can't write any kind of feedback. And so I think one of the things that is good for any of us when we're upset and we're looking at something online is to wait, because if you write it right away, it might be very clear who you are, responding to. But if you give yourself time and really think about it and decide, do you need to respond? And if you choose to respond, how you choose to respond, then that would be much better than, responding the same day you see it, because then you might still have too many fresh details from the encounter in your mind, and those might show up as potential HIPAA violations. And so we have to be very careful.
Mm-hmm. And interesting when the patient is the first reach out, right? So when we notice that in how we react again and reacting versus responding, right? That thoughtfulness, putting that little bit of space and pause in there, and then considering, can I do this in a depersonalized way, both ways, right? Not taking it personally, not implicating their actual direct clinical experience, but it does take some crafting, right? Some extra work in there. And like you said, deciding what the reserve is, do we have the energy, or who does, right? If we have a person in the office or in our practice that can help with that, that can be useful. Parastoo, anything from you on how you might respond in a neutral way?
I wouldn't usually respond for the same reason that was brought up, because I think it's a very fine line, and I don't want to get into the legality of things. I think I know the way that I approach that, I just basically let it be. So, and just like move on. I try to, if there is any constructive feedback, to just basically take that from the encounter and try to use it as an opportunity to improve. But if it's something that is just basically something like totally nonsense, or I cannot figure out what happened, so I think I just move on. Mm-hmm. That's the way I approach.
Interesting if there's an opportunity even to just notice. That sounds like a very challenging experience, and not necessarily like there's the apology and admission of guilt in that way, but there are ways that we can respond as well that just says, I hear you, right? In that frustrated response, that must have been a difficult encounter. Thank you for pointing out your experience. Thank you for sharing. There are ways in kind of like the bully experience, right? If we agree with the bully, they say your shirt is ugly or this, and you just say, oh yeah, it kind of is, we diffuse it in a way, right? Because they're not going to keep after you because you've agreed with them. And so considering that as we navigate these potential opportunities. As we're looking at the experience of reviews, how have you noticed they've actually been held up as a value measure? So we have reviews, we also have, hospital-wide, we have Press Ganey, we have the simple surveys. Have you run into it where they've been utilized to influence, payment, reimbursements, positioning, any kind of, remediation? And that could be for you directly or just seen in your system or practice. Do you see them come up that way? And how are you made known what your review results are other than like on Google or Yelp? If it's an internal thing, how do you receive those? Anybody's free to answer.
So in my private practice, it would just be me. I would see them and, and I typically do. I'm reading Dr. Lynn's responses here. You might want to address those because he's commenting that really, never ignore a negative review. No response is a response, and I do agree with that. But many times your hands are tied if you are not in a private practice situation. So in my own situation, I would have responded, but in a group setting. Currently, like I'm working in a university setting, and so when I have my year-end peer review, they literally pull up every single comment any student has made about me during the past year, and we go over it. And I'm fortunate that it's usually a pat on the back, but that we get told all of them.
Yeah, and looking at that, can it be constructive? Like you said, thankfully they're generally positive. And even if they're not, do they give any, functional means of creating an improved system if that's the challenge? All right, I'm going to read a couple, and I've been addressing them in the questions and how we're responding to them, but never ignoring, not hiding behind HIPAA and looking at ways to answer in a neutral way, acknowledging with empathy. Those are all the ways that Dr. Lynn is advising. And even looking at the number of new patients who seek you because of your review. So looking at the purpose behind them, so what reviews can actually do to support your practice. But if you have any further feedback on that idea behind how reviews are utilized or presented to you, Sheryl, have you had any of that experience where someone has actually said, this is what we've received?
Within my hospitalist group, we did receive Press Ganey results. And they were based on, I guess, patients who had Medicare as their insurance, and they had completed the survey after being discharged. I work as the admitting physician, so I see them on day one, and half of the time they're obtunded. So I had one review, and it said that I was abrupt, but I don't discharge. And so if I was abrupt, then that means they left against medical advice. And so I felt sad about that because I have no idea which patient that is, but at the same time, a lot of the time that means that there's an unmet need. And so I work really hard with my patients that want to leave against medical advice or have, a lot of those social issues when they come in, because that's one of my main focuses that I have in medicine is making sure that I can break down those barriers. And so for me, I have no idea who wrote it. And we didn't get that many reviews as a group, even though we have a lot of patients, but they tell us good things in person. And so for me, that's enough. I know that the job that I'm doing holds value.
Excellent. Parastoo, how about for you? How are you presented with, or do you present reviews to others in your practice?
So I was working at UCLA before I moved to Austin. So they had actually a very good system in place at UCLA that they were randomly selecting patients, and they were calling and basically getting feedback from their experience that they had with the physician. And those were used in sort of like our semi-annual meetings that we had with the chair of the department and our mentors in terms of, future promotion, which I think that they're pretty useful because they were calling a lot of people. So that was just sort of like giving a good idea of, how a physician is perceived in the practice and how a physician is practicing, which I think is pretty fair, because if you see a trend of behavior that's, going on and on after you survey 100, people, and, 90 of them, they're saying that they had this terrible experience. I think you cannot disregard that. That tells you something. And I think that is a more accurate way to basically assess a physician, to bring up specific questions that a committee came up with, which is in accordance with the whole, the goal of the organization.
Yeah. And we're getting some comments here and feedback looking at the financial and professional influence of reviews, and an inquiry if it was worth it enough to have a marketing department, someone helping to manage that. And we have some response that no, it should be direct, right? The physician should deal with that directly. I wonder what thoughts you have around there, and noticing, again, we all have different systems where we may not be the direct person to address that, on Google or Yelp, which John has also noted as relevant more than Press Ganey. So any thoughts on who should manage the response to reviews if we're going to go there? Sheryl, what do you think?
I'm not sure how I feel about this, because I don't even believe that we should be allowing patients to write reviews about us on Yelp where it's difficult for us to have an honest discussion. And so I don't know who I would want to have managing those reviews that, really don't add value to our medical care. I've seen physicians devastated over comments written about them, and known them personally as excellent physicians. And I've seen them work, and I know how amazing they are. But even as we've said, one bad review can make you feel, like you've done nothing good, when all you've done is pour your heart and soul into medicine. So I'm not really sure who I think should be managing it, because I think some places might take it to an extreme and use it as a hiring measure or a firing measure. But I think for an individual physician, it's very important just to, reflect on what patients think of us in whatever form that they've communicated it.
And noticing too that other patients do utilize those mediums to seek physicians. And for some who might not, have that accessibility, if again, you're in the hospital system and they choose the hospital maybe by default, region, insurance requirements, versus sometimes in private practice when we are trying to build up that panel and noticing that outward facing relationship. Jill, what's your thought on that?
It's completely dictated by your setting. I mean, I would not be allowed to respond directly to anything said about me in my capacity as a physician at a university. I mean, the lawyer, that's absolutely positively not allowed. And so I just think it really depends on your setting. I understand what Dr. Lin is saying about how, that can really drive traffic to your practice. And that is a reality. And if it's your private practice, then I think it would be good to be addressing them. But it's tricky.
Yeah, and we have those levels and layers in the hierarchy of a system. We be mindful of that. There is a caution in the chat that a canned response by an external agency can show how much you don't care about the patient, and that can be viewed by future potential patients, and encouraging thinking about who is reading this and what experience they're having ahead of time. And Parastoo, anything for you, how you would like that managed, or recommendations you have for management of those directly or through a marketing team?
I think the same as Sheryl, I'm conflicted about this issue. I don't know. It's, I think, very challenging. I overall don't think, I don't think physicians, really, it's just very tricky that they get reviews on Yelp. And, while our hands are tied and we cannot even just basically talk freely or say what, just like discuss that, or, basically talk openly about what came up. And I see a trend which is very concerning, unfortunately. And I think it's used, the physician review, unfortunately, is being used by middlemen and third parties here as sort of like a punitive measure, and also just to basically sort of like define payment, reimbursement, or controlling physicians as a whole, which is unfortunate, and I think which is very sad to see we are going that way, that we are giving all our powers as physicians to this, third parties that are basically dictating everything, and they're trying to just find things in order to, basically punish us for anything, and then just hold the reimbursement and payments and other issues. So I think that's why it's very tricky. And just going back to the conversation from yesterday, we are dealing with insurance companies. We are not hotel business. We are not getting cash out of patients. So it's a total different business model. So you cannot really compare that, because I'm getting reimbursed by insurance companies that are getting more and more powerful every day, while the hotel industry is just like a totally different business model. They're just getting people in, they're charging them directly, and they have a totally different path. And I see the way that we are going, unfortunately, we need to do something, because this is not going to be sustainable for physicians to be reviewed, not be able to discuss anything, and this would eventually affect the way that we practice medicine.
Mm-hmm. So some really great points this evening. As we come toward the close of the hour, I want to make sure we have time for you to tell everyone where to find you, what you're doing most recently, and any last take-home points on reviews. So thank you to all who participated in the chat, and for those of you tuning in as we discuss reviews in our physician panel as a follow-up to the Tuesday night lecture series. Sheryl, let's start with you. Where can our members find you? What are you up to lately? And any closing remarks on reviews?
Okay. I am a writer as my side gig, and I have an Instagram and Twitter account, both with my label as @MD.Sheryl. And my most recent work is not published yet, but I'm working on a YA novel, and hopefully I'll have some feedback on that pretty soon. I also am going to relaunch my memoir. I had a copy that was on my Peloton and it fell down, but my memoir is Hindsight, and it's a story about when I was much younger as a homeless teen in Hollywood. And so it's a book that I hope many physicians read so they can understand, what that experience is like, because we have a lot of patients who do struggle with homelessness and other issues. And reviews, just continue giving positive reviews for our peers when we see them and encounter them in the medical setting. I hadn't thought about it, and I'm glad you guys pointed that out. Thank you.
Yeah. And do you have a website for your books?
I do. It's www.SherylRecinosMD.com. So if you look at my name there, just sandwich it between www and .com.
And Parastoo, how about for you? Where can our members find you, and what are you up to? And last remarks on reviews.
So I'm, as I've said earlier, I'm a gastroenterologist, and I'm also a life coach. So I'm incorporating the life coach and mindset work in treating patients with GI disorders, specifically with functional GI disorders. My niche is gut health, brain-gut interaction, and gut microbiota. And I also work with patients in weight loss and fitness. So I'm in social media. I'm Mind Gut Fit MD on Instagram, Facebook, and Twitter. I'm mainly active on Instagram these days, so that's where people can find me.
Thank you. And Jill, how about for you?
All right, I'm going to start with putting in a plug for Sheryl's book. If anyone is no, I'm completely serious. Totally, you will never look at a young person experiencing homelessness the same after you read her story. It is so inspirational. And thank you, Sheryl, for being willing to put your story out there. It is just amazing. So I'm Jill Grimes, MD. My website's jillgrimesmd.com. Same thing. I'm really not very active on Instagram, but that's my Instagram handle, and Twitter. It's also my Twitter handle, Jill Grimes MD. And My most recent book is the Ultimate College Student Health Handbook, your guide for everything from hangovers to homesickness. And it's humorous, but all evidence-based medicine. And I just really enjoy working with the college student population. And so those are the places you can find me. In terms of the reviews, I agree with Sheryl. I think, I realized that I had been a patient recently, and I need to post some reviews because I got excellent care, and I need to put that out there. I need to, and the thing is, reviews don't take that long. And a lot of people, I want to say this, my experience with book reviews is people don't know what to write. They get, very anxious when they start to review a book, and they think, well, and they labor over it. It's like, you know what? Don't labor over it. But if there's something you like, put it there. If there's a picture in the book that you can flip to, take a picture of one of the chapter titles, put that in there, because the pictures help with reviews in terms of book reviews. And same thing with doctors. If there was something you particularly liked, just say, the receptionist was so welcoming. That's great. Or I didn't feel rushed, or I really felt the physician listened to me. Whatever it is you want to say, but don't labor over it. Just do it, because it doesn't take very long if you just sit down and do it. But if you put that on I want to really think about that, and I want to make sure I say the right thing, it's never going to happen, and you don't do it. So let's support our peers by doing that.
And like you said, capturing that patient while they're still there, right, in that moment of exuberance can be so helpful.
Absolutely.
Thank you all for taking the time, for watching, for sharing, for following on the chat questions. I think we have a lot of new perspectives on how reviews maybe can be for the good and how we can choose to think about them as well. Hope you'll join us. We have our panel every week following the SoMe lecture series. I'm Amelia Beakey, and I'm at This Osteopathic Life on Instagram, and that's my website as well, supporting the health of all things. Thank